today we are going to do the next model paper for the PSC Kerala PSC exam for assistant dental surgeon. Okay, so this question paper will be not only useful for PSC but also for NEET MDS exam of 2026. Okay, so please do refer the questions again and again, revise it again and again, so it is a quick revision for you guys. Okay, so let's start. So coming on to the first question, which of the following efficient methods of managing interproximal soft tissue while making elastic impression? Okay, which of the following efficient methods of managing interproximal soft tissues while making elastic impression? Options given are rubber dam, use of chemically impregnated cord, electrosurgery, or all of the above. So what will isolate the interproximal areas, okay, while making elastomeric impression after tooth preparation? Okay, so that is a question. So mainly most of the times we can use option B, use of chemically impregnated cord. It will be more useful for taking elastomeric impressions. Okay, so question number 2, which of the following gingival retraction cord is used in hypertensive patients? So in case of hypertensive patients, what do you use? Plain retraction cord or retraction cord with 2% of racemic epinephrine or retraction cord with 8% of aluminum chloride? So you have a confusion between or none of the above. So there is a confusion between option B and C. Okay. Retraction cord is used with 8% of aluminum chloride in case of hypertensive patients. Okay, in case of hypertensive patients, you use 8% of aluminum chloride. Question number 3, Pontic design not indicated in the anterior region. So which is the Pontic design among the given options? Ovate Pontic, modified ridge lap Pontic, Steen Pontic, spheroidal Pontic. Okay, so ovate Pontic is used in anterior region, correct? Modified ridge lap Pontic also can be given in the anterior region. Steen Pontic can also be given in anterior region. So the one among the odd one out is spheroidal Pontic, which is not indicated in the anterior region. Okay. Question number 4, fracture of the porcelain is prevented by using group function occlusion or canine guided occlusion or preventing a balancing side contact or using high glaze porcelain. Fracture of a porcelain is prevented by giving a very good canine guided occlusion. Okay, so canine guided occlusion can make the porcelain restorations very resistant to fracture. Okay, question number 5, cement used for aluminium cement used for cementing of the veneers. Okay, cement which is used for cementing of the veneers. Options: zinc polycarboxylate, zinc phosphate, resin modified GIC, or conventional GIC. What is used? Resin modified GIC is used for cementing of the veneers. Okay, resin modified GIC, not conventional GIC. Question number 6, Class 4 Kennedy's classification. This is easy. Okay, so what is Class 4 Kennedy's classification? This is basic. Bilateral edentulous area located posterior to the remaining natural teeth? No. Unilateral edentulous area located posterior to the remaining natural teeth? Definitely no. Third one, unilateral edentulous area with natural teeth remaining both anterior to the remaining natural teeth and posterior to it. That is actually Class 3. A single but bilateral edentulous area located anterior to the remaining natural teeth. So the edentulous area located in the anterior region, but it should be bilateral. A single but bilateral edentulous area. That means from canine to next canine. Okay, so that entire area will be missing. Centrals and laterals and canine. So that anterior region is actually, if it is edentulous, then you can go for Class 4 Kennedy's classification. 7th question, in Kennedy's classification, the least common arch is Class 1, 2, 3 or 4. In Kennedy's classification, the least common arch is actually Class 4. Most of the times you don't get Class 4, isn't it? Question number 8, posterior palatal bar is placed on the soft tissue or placed on the hard palate entirely or at the junction of hard and soft palate, or should be kept 0.5 to 1 mm away from the mucosa. The posterior palatal bar is actually placed at the junction of the hard palate and the soft palate. Question number 9, relief under a maxillary major connector is generally not required, is required, may be used, may not be used. Relief under a maxillary major connector is generally not required. Okay, generally not required. Kennedy bar is also known as double lingual bar or lingual plate or lingual bar or palatal plate. Kennedy's bar, the other name for Kennedy's bar is actually double lingual bar. Okay, double lingual bar, Kennedy's bar. Question number 11. Which is the cement with adhesive property? Zinc oxide eugenol, zinc polycarboxylate, silicate or zinc phosphate? Which is the cement with adhesive properties? Adhesive property. The one with adhesive property among the options is zinc polycarboxylate. Okay, zinc polycarboxylate. Coming on to 12, in which of the cavities is amalgam contraindicated? Class 1 or 2 or 4 or 5? 1 and 2 definitely we have done in clinics, isn't it? Amalgam restoration. 4 or 5? So the options are 4 or 5. So definitely 4. Okay. 4 is the exception for class 4 cavity. We don't give amalgam restoration. Coming on to next question, 13th question. The color code for the regular size pins in the thread meat system is actually whether it is gold or silver or pink or red. Everywhere you see gold pins, isn't it? So in the thread meat system. So it is correct answer is A. Coming on to 14, which of the following is material of choice in class 5 cavity with effraction? Class 5 cavity with effraction, GIC or hybrid composite or microfilled composite or compomer. So they are telling there is a condition called effraction. So in case of effraction, occlusal trauma will be there. So in that case, you have to give microfilled composite. Okay, microfilled composite is the better restorative material. 15. The inlay wax used for direct technique. What is the inlay wax used for direct technique? Type 1, 2, 3 or 4. For inlay wax, we use type 1. Okay, for mainly for direct technique we use type 1. Universal matrix band retainer is also known as Toffel-May retainer. It's a very easy question. Okay. 17. The recommended rubber dam retainer for maxillary molar anchor teeth is W7 or W8 or W4 or W2. So the rubber dam retainer for maxillary molar anchoring. So in case of rubber dam, if you use for maxillary molar, we give W8. Okay, just remember W8, the numbering. Question number 18. The recommended clamp for class 5 tooth preparation is number 213 or 212 or 123 or 122. Okay, it is actually 212. Okay, the clamp for class 5 tooth preparation is 212. 19. The cutting efficiency of a burr is improved by applying more pressure or more number of blades or large size of the burr or giving a rake angle. So you give a rake angle, the cutting efficiency of the burr will improve. Okay, that is the importance of the rake angle. Question number 20. Which of the following is the main constituent of porcelain? Feldspar, kaolin, quartz or clay? Which one? Feldspar. Okay, main constituent of porcelain is actually feldspar. Question number 21. Round ribbon shaped avoid bowling pin and kidney bean are all types of root canals seen in which type of cross section? Sorry, in which type of section? Actually, in cross section we see all this, isn't it? Round, ribbon shape, ovoid, bowling pin and kidney bean. All these are the shapes of the root canals seen in the cross section. Okay. Coming on to 22. Pulp of the involved teeth is vital in the following: apical cyst or granuloma, apical periodontitis or phoenix abscess. So most of the times in apical cyst the tooth is non-vital, in granuloma also non-vital, in phoenix abscess also non-vital, but in case of apical periodontitis, most of the times apical periodontitis you find a vital teeth. Okay, and the cause is most of the times a trauma. Okay. Now 23, purple colored reamer is numbered as 8, 10, 15 or 30. Purple colored, so all these numbers you have to remember, okay. So the clamp number, all that is important. Purple colored reamer is the number which is given for 10. What is the number? 10. Clear? Now question number 24. Cross section of the K file is traditionally made from rhomboidal, circular, spiral or double helix. Cross section of a K file. So K file cross section is actually coming from a rhomboidal shape. So 24A. Coming on to 25, instrument used for lateral condensation of the GP along the canal wall. So during obturation, after inserting the GP point, you give a lateral condensation, isn't it? After placing the master cone and the lateral cones. So that lateral condensation, for that you use what? You use a spreader, not a plugger, okay? For cleaning and shaping, you use barb. For removing all the pulp debris, you use barb broaches. So for in case of lateral condensation, you go for a spreader. Okay, 25D. 26. According to Ellis and Davis classification, a fracture of 5-1. Okay, the clue is given as 5-1. 5-1 is what? A deciduous tooth, a pedo tooth, involving dentine and associated loss of vitality. All that is not a concern for us. They have directly asked you the classification. So, for pedo fracture, for deciduous tooth fracture, always go for class 9. Okay, just remember that way. 26D. Question number 27. So, in each question, there will be a clue to the answer, okay, and there will be a clue to rule out the other options. So just check for that in MCQs. That is the easiest method. So just point out the clues, and with that clue you have to cross check the options, rule out the odd ones, and then pick the correct one, okay, because the time is very less. Question number 27. The initial rapid bone resorption in apical periodontitis can be prevented by the administration of acetaminophen or ibuprofen or aspirin or indomethacin. They're directly asking you bone resorption prevention. So ibuprofen and all will not reduce the resorption part. The one which will directly stop the resorption part is actually indomethacin. Okay, indomethacin. So answer is D. Calcium hydroxide is given in weeping canal. Okay, in weeping canal. First option itself is correct. When there is bleeding from the root canal, no. As a sterilizing agent, no. To remove or dissolve the periapical periodontitis, no. In a weeping canal. Okay, calcium hydroxide is definitely given in a weeping canal. 29. And only once that weeping, that means that infection is removed or it is over, you go for obturation. Question number 29. If a patient has gingival recession, how far should the GP be trimmed back before sealing the coronal area? Okay, so the patient is already having gingival recession. So you have to trim the GP point because that much working length is not required. So how much will you trim? Okay, because expecting that a gingival recession will occur further, how much will you trim? So you have to definitely trim 1 mm, but whether it is below the level of recession or below the ACJ or below the canal opening or below the roof of the pulp chamber, that is a question. So definitely it is 1 mm, but it is below the level of the recession. Okay, 1 mm below the level of the recession. Okay, 30. Triple antibiotic paste is applied at which area? Cemento-enamel junction or apical to cemento-enamel junction or cemento-dentinal junction or coronal cemento-enamel junction. So it is applied apical to the cemento-enamel junction. Okay. So the triple antibiotic paste is applied apical to that of cemento-enamel junction. Okay. 31. That is towards the root area. Question number 31. Antifungal drug not used in the treatment of intestinal candidiasis. Okay, they are asking about systemic candidiasis. So intestinal candidiasis, the one antifungal which we don't use. Okay, so amphotericin can be used, nystatin can be used, ketoconazole also can be given systemically, not clotrimazole. Okay, so option D is the answer. Question number 32. Which of the following is caused by amphotericin B? Hypokalemia or hyperkalemia or hypermagnesia or hyponatremia? Definitely potassium is affected in amphotericin B. Okay, so it is hypokalemia or hyperkalemia. So you remember that. How I remember is amphotericin has got a P, isn't it? For P. So that P is definitely going for potassium. So hypokalemia or hyperkalemia. It is actually hyperkalemia. Amphotericin causes a hyperkalemia. Okay. Coming on to 33. Which among the following anti-HIV drug is also used to treat viral hepatitis B? The one which is used, enfuviridine or lamivudine or efavirenz or ritonavir. So the one which is having a dual purpose is actually lamivudine. Lamivudine can be given in HIV patients also. It can be given in hepatitis B also. Okay. 34. Succinylcholine choline prevents bronchospasm by depolarizing block or direct muscle relaxation or centrally acting muscle relaxation or dual action. Succinylcholine choline preventing bronchospasm by depolarizing the block. Depolarizing the block. Succinylcholine choline prevents the bronchospasm by depolarizing the block. Okay, so it will relax. Coming on to question number 35, excessive bleeding due to heparin overdose is controlled by, so the antagonist of heparin, that is a question. Antagonist of heparin is protamine sulfate. Okay, just by heart. Heparin overdose, you have to give protamine sulfate. Question number 36, which of the following drugs undergoes Hoffman elimination? D. Tubercularin, acetylcholine, or etracurium, or acetazolamide. So the one which undergoes Hoffman elimination is etracurium. Okay, etracurium. 37. Curare poisoning is characterized by hypertension. Hypotension doesn't release the histamine. Oral route of administration is the best route. So curare poisoning is characterized by hypotension. Okay, hypotension. Hypotension. Okay, it will decrease the blood pressure. Curare poisoning. 38. L-thyroxine can be given safely in cases of hypothyroidism, hyperthyroidism, Hashimoto's, or Graves' disease. Thyroxine is given in hypothyroidism when thyroid hormone is less. Drug which is used to control the status epilepticus is actually diazepam, or actually it is diazepam. Sodium nitroprusside or glycerol trinitrate or phenobarbital. The most common drug for status epilepticus is diazepam. 39/40. A 50-year-old female with end-stage renal disease develops pulmonary tuberculosis. Which one of the following drugs should be used in reduced dose? So it's a pulmonary tuberculosis, a bacterial infection. Patient is a kidney patient. Okay, kidney disorder, renal disease. So rifampicin or isoniazid or pyrazamide or ethambutol is given in low doses. The one which has got less chemical reaction. Okay, so the one which has got less metabolism, less metabolism. Okay, so the one which has got less metabolism among the four is ethambutol. Okay, ethambutol. Question number 41, barbiturates in pediatrics is contraindicated. Low safety, can be used safely or not much use. It is actually low safety. Pediatrics, you don't give barbiturates much. Okay, low safety. Question number 42, drug administration of NSAIDs in children. The most important dose administration is, always you have to remember, whenever you take the child to the pediatrician always go for checking the weight of the child, isn't it? Only after checking the weight, the pediatrician writes the drug. So remember that way, weight of the child is important for drug administration. Okay. 43. Drugs highly bound to albumin. NSAID, lidocaine, beta blockers of verapamil. NSAIDs directly bound to albumin. Okay, the protein. Question number 44. Omeprazole is an antihistamine or proton pump inhibitor, ulcer protective or ulcer healing drug. It's a proton pump inhibitor which is used as an anti-vomiting agent. Okay, proton pump inhibitor. 44B. 45. Modulus of elasticity means what? Elasticity. So it will check the rigidity, isn't it? Elasticity means rigidity or stiffness of the material is checked here. Okay, 45A. 46. Elastomas are alginate, agar, polyethers or impression common. Elastomas are what? They are polyethers. Okay, just remember, polyether category comes, the elastomas comes under polyether category. Ether, elastomer. Ether, elastomer. That way remember. Question number 47. The commonly used laser for curing, it's actually curing composite resin. So after applying the composite, you use the light, isn't it? The laser. So what is that laser actually? Nd:YAG or carbon dioxide or YAG or argon? It's actually argon. Okay, argon lasers. Okay. 48. What is the wavelength? It is actually is. Okay, is typing mistake. What is the wavelength of visible light used for curing light cure restoration? 400 to 420, or 250 to 300, or 420 to 475, or 300 to 370? It's actually 420 to 475. The wavelength is for curing is 420 to 475. 49. Increase in the residual mercury in silver amalgam filling can cause fracture of the filling. Sure, it will cause fracture. Yeah. Tarnish and corrosion, increase the strength, decrease the condensation pressure. Of course, it causes the fracture of the filling. That is why always when we do in clinics, we practice clinic, they give a very less amount of mercury. Isn't it? Correct amount they will give, because if mercury is slightly high, it will cause fracture of the filling. 50. Over trituration of the silver alloy and mercury reduces the contraction, increases the strength of the lathe cut but reduces the strength of spherical alloy, decreases the creep, gives a dull and crumply amalgam. Over trituration of the silver alloy and mercury will increase the strength of lathe cut but it will reduce the strength of spherical alloy amalgam. That option is correct. 50B. 51. Glossy smooth margins of a casting are due to shrinkage of alloy on cooling, or investment breakdown, or incomplete wax elimination, or incomplete gas elimination. Glossy smooth margins of a casting are due to when you get a glossy appearance, when the wax is not completely eliminated. So incomplete wax elimination. 51C. 52. Which zone is the hottest, okay, and efficient burning zone of the flame used for casting? So which part you use? You always go for a reducing zone, okay. Oxidizing zone, reducing zone, combustion zone, or none of the above. Reducing zone is the best zone, okay. Okay. 53. The inlay wax commonly used for direct technique is 1, 2, 3, 4. Which is the inlay wax? I think this question is a repetition. Okay, inlay wax commonly used for direct technique. We dealt the same question before. Type 1. Okay. Sorry, I won't repeat the questions in model papers, but this came by mistake. Okay. 54. The purity of gold is expressed in carat. Yes. Percentage of fineness or gram. So we always say gold in carats, isn't it? But actually the purity of the gold is expressed in fineness. Okay, so option C is correct. 55. Which among these is not an ideal property of the soldering material? Corrosion resistant, non-pitting, high fusing, or free flowing? See, high fusing type cannot be you cannot go for high fusing, so it is not ideal property. 55. C. 56. The cement which is least soluble in oral cavity. The one which is least soluble is resin cement. Okay, glass ionomer is soluble. Polycarboxylate is also soluble. Silica phosphate is also soluble. Resin cement is least soluble. Okay, and the most soluble cement will be just the opposite. Question 57. Most soluble polycarboxylate cement. Okay, 57D. So the least soluble is resin cement and most soluble cement is polycarboxylate cement. Remember, that is why I have put both the questions together. Okay. 58. Fovea palatine are structures through which blood supply take place, mucosal salivary glands, palatal termination of the maxillary denture found in every individual. They are actually, fovea palatine are actually what? They are actually mucosal salivary glands. Okay. Mucosal salivary gland. Coming on to 59, cellular cementum and compact bone contains what? Cellular cementum contains Sharpie's fibers and elastic fibers? No, they contain Sharpie fibers, definitely. Collagen fibers and blood vessels? No. Canaliculi and incremental lines? Yes, both of them contain what? Canaliculi and incremental lines are both are present in cellular cementum and compact bone. That is the similarity between a bone and a cementum. Okay, so there is a very high similarity between bone, cementum and the bone. So what is the similarity? Both of them contains canaliculi. Bone contains canaliculi and both of them contains incremental lines. Okay, clear? Coming on to 60, the main function of the horizontal fibers of the periodontal ligament is to prevent extrusion, to prevent rotation, to maintain the mesodistal width, all of the above. So definitely you have a tendency to go and mark option D, but they are asking you in question, what is the main function? They're not asking you what are the functions of horizontal fibers. They're asking you what is the main function. So you have to stress upon the main function, that is maintains the mesiodistal width. Okay. Where was the ART first developed? Okay, atraumatic restorative treatment. Okay, atraumatic restorative treatment was first introduced in which country? Tanzania. 62. One of them is not a principle of health education. Credibility or feedback or setting an example or utilization. Definitely you have to, whenever you go for a health education, you have to be, credibility is important. You have to tell only the truth and you have to practice only the ethics. Secondly, you have to take the feedback after health education. You have to set an example by giving the correct example and correct doing the correct things. And lastly, utilization is not a part of health education. So option D is the one. 63. Not true about National Rural Health Mission. Okay, NRHM. Appoint an ASHA worker, strengthen the institutional delivery under JSY, Health and Family Welfare Societies, State and District Health Mission. So NRHM always does State and District Health Mission. Okay. Health and Family Welfare Societies, no. They appoint as ASHA workers. Then strengthen institutional delivery is also done by NRHM, but Health and Family Welfare Societies are not coming under NRHM. Okay. 64. PHP index was given by which scientist? Glass, Arl, or Grossman, or Podgsley, or Strensenberger, who gave PHP index? It was given by Podgsley and Halley. Okay. So I remember PHP. So the scientist also starts with P, isn't it? P, Halley, H. Okay. PHP. 64. C. 65. Essential fatty acid present in the breast milk which is required for the normal growth of the child is linoleic acid or palmitic acid or docosahexaonic acid or EPA. It is docosahexaonic acid which is present in the breast milk which is essential for the child development. Okay. 66. The best technique useful for initial viral load estimation, real-time PCR or Vidal test or electrophoresis or immunofluorescence. The best technique for initial viral load is always the PCR. Okay. Remember the COVID times we always went for PCR, isn't it? After doing the initial test. 67. Graft versus host reaction is caused by B lymphocytes or T lymphocytes or monocytes or leukocytes. So the graft versus host reaction is given by T lymphocytes. Okay, T lymphocytes. Interleukin 1 is produced by helper T cells or helper B cells or monocytes or macrophages. It is produced by macrophages. Okay, interleukin 1 is produced by macrophages. The gram-negative bacteria most numerous in oral cavities, Streptococci, Veillonella, Selenomus or Echinella. So Streptococci is gram-positive, okay. So you should not mark Streptococci. Veillonella is gram-negative. So Veillonella, gram-negative bacteria most numerous in the oral cavity is Veillonella. 70. Cusp of Carabelli can be considered as a normal finding in permanent maxillary first molar and deciduous maxillary second molar. So option C. Okay. Cusp of Carabelli is mostly seen in permanent maxillary first molar and deciduous maxillary second molar. Okay. 71. Shell teeth more commonly seen in dentinogenesis imperfecta 1, 3, 2 or 3 and 1. It is 2. Okay. Shell teeth is type 2 of dentinogenesis imperfecta is called as shell teeth. Okay. 72. All of the following are inherited disorders of connective tissue except. So you have to know the pathogenesis. Alport syndrome is a connective tissue disorder. Ehlers-Danlos syndrome is also a connective tissue collagen disorder. Marfan syndrome is also a collagen disorder. McArdle's disease is not a connective tissue disorder. Okay. Question number 73. Hepatolenticular degeneration is seen with deposition of cadmium or lead or aluminum or copper. So hepatolenticular degeneration is seen with the deposition of copper. Okay. Degeneration. Hepatolenticular degeneration is seen with deposition of copper. Okay. 74. Bald tongue is not seen in pyogenic stomatitis, Rhetus disease or atrophic lichen planus or psoriasis. Bald tongue is seen in psoriasis, isn't it? It is seen in lichen planus also, atrophic. Atrophic type of lichen planus will show you a bald tongue. Rhetus disease also you have bald tongue. Pyogenic stomatitis, definitely no. So option A. 75. Amino acid that is high in root dentin used for age estimation. Tyrosine, serine, aspartic acid, glycine. The test itself tell you aspartic acid racemization technique. So aspartic acid is the amino acid with which is present in root, which is used for age estimation. Okay. 76. For IUPA purpose, which films are used? Always go for D and E in case of IUPA. Okay, always go for D and E. 76B. Which of the following resembles caries in radiograph? Zinc oxide, eugenol, or zinc phosphate, or GIC, or polymethyl methacrylate? Polymethyl methacrylate looks like caries in case of radiographs. Okay, polymethyl, it is radiolucent. Okay, polymethyl methacrylate. 77D. What is ALADA is? What is the full form? As low as diagnostically acceptable or advisable or achievable or attainable. So just remember, it is as low as diagnostically acceptable. Acceptable. 78C. Intensifying screens are used in extraoral radiography as it covers X-rays into what? They convert X-rays into visible light. Okay, intensifying screen will convert the X-rays into a visible light. 79B. 80. Radio density can be increased by decreasing the ampere, that means the current, decreasing the voltage kVp, or decreasing the target film distance or increasing the target film distance. So if you have a too much distance between the target and the film, the density will be low, definitely. So to increase that, you have to decrease the distance between the target and the film. Okay. Option C. Coming on to 81, sternocleidomastoid and trapezius are supplied by cranial accessory, spinal accessory, vagus or glossopharyngeal. So, the sternocleidomastoid and trapezius are supplied by spinal accessory nerve. Okay, spinal accessory. Both sternocleidomastoid and trapezius supplied by spinal accessory. Just remember, spinal accessory. It is a direct question from the anatomy. Question number 82. In elevation of the eyebrows and production of transverse wrinkles of the face, only the occipital bellies of occipito frontalis is used, or only the frontal bellies of occipito frontalis is used, or both the bellies act together, or both the bellies act one after the other. So, both the bellies, okay, in occipito frontalis, both the bellies have to act together to produce the wrinkling of the face and the movement of the eyebrows. Okay. 83. An infarct most frequently is characterized by what type of necrosis? An infarct most frequently is characterized by what type of necrosis? A fatty or caseous or gangrenous or coagulative. So whenever there is a reduced blood supply, that is whenever there is a coagulation, there will be an infarct development. So coagulative type of necrosis will give you infarct. Question number 84. Leukopenia is characteristic of appendicitis, enteric fever, meningitis or myocardial infarction. So the leukopenia, reduced white blood cells. Leukopenia is characteristic of enteric fever. When you have an enteric fever, the blood count will go low. Okay. 85. A 40-year-old female came with fullness in the upper right quadrant of an abdomen with diabetes type 2, hyperlipidemia, and biopsy will show biliary cirrhosis or luminal thrombosis or non-alcoholic steatohepatitis or autoimmune hepatitis. Okay, so fullness in the upper right quadrant of the abdomen with type 2 diabetes, the hyperlipidemia. So hyperlipidemia is a characteristic feature of what? Hepatitis. Okay, so non-alcoholic steatohepatitis. Okay. Question number 86. The approximate amount of air left in the lungs after maximal forced expiration in a normal woman. Okay, so they have told you a woman. So after forced expiration, the amount of air which is left in the lungs will be only 1.1 liters. Okay, 1.1 liters. What is PTA? So among the clotting factors, what is PTA? Antihemophilic factor or antihemophilic B factor, antihemophilic C factor, antihemophilic F factor. They have put all the ABCDs. So PTA is actually antihemophilic C factor. Okay. Hessel's corpuscles are seen in 88. Hessel's corpuscles are seen in lymph nodes, spleen, thymus or tongue. Hessel's corpuscles are a feature seen in thymus. It's an easy question. 89. Ectomorphic, mesomorphic and endomorphic classification of body physique was given by Sheldon. Okay. Now 90. Down cephalometric analysis uses which line as a reference plane? Down cephalometric analysis uses ANS, PNS, SN plane, Porion, orbital or Gonian median. All these are questions are direct questions and answers. Okay, there is nothing much to think about. Down cephalometric analysis uses Porion orbital. Okay, Porion and orbital as reference plane. Downs uses Porion and orbital. Okay. Battle sign is subconjunctival ecchymosis, sublingual ecchymosis, palatal ecchymosis in the mastoid region. Okay, definitely last one. Ecchymosis in the mastoid region is battle sign. 92. Dowtry procedure is used for correction of prognathism or correction of ankylosis or correction of recurrent dislocation of mandible or none of the above. Dowtry procedure is used for correction of recurrent dislocation of the mandible. Okay, 92C. Obstructive sleep apnea is caused by mandibular ameloblastoma? No. Dentigerous cyst? No. Orbital fracture? No. Bilateral TMJ ankylosis? Yes. Okay. Bilateral TMJ ankylosis will definitely cause sleep apnea, obstructive sleep apnea. Sagittal split osteotomy was first advocated by Obwegisser, Dupont, Wanderer or Moose. Obwegisser. Sagittal split osteotomy was first advocated by Obwegisser. So the technique is called as Obwegisser's sagittal split osteotomy. Okay. 95. A in WARF's assessment stands for what? So in impaction cases, the WARF assessment is done. So A stands for angulation, angulation of the impacted molar. Okay, 95. Sorry, angulation of the impacted tooth. Okay, impaction case. Okay, so angulation of the impacted tooth, 95D. So that option C and D is confusing. If you slightly, if you are careless, you will mark for molar, because most of the times that picture in the Nilima is telling you the molar impaction, isn't it? So angulation of impacted tooth you have to tell. Okay. 96. Osteotome differ from chisel in that it is osteotome is bibeveled. Okay. 96B. Osteotome is bibeveled. There are two T's in osteotome, so it is bibeveled. Okay. 97. Treatment of malignant hyperthermia is what? Propranolol, halothane or dantrolene or nitrous oxide. Treatment of the malignant hyperthermia is dantrolene. Okay. Malignant hyperthermia you give dantrolene. 97C. Okay. Which of the following drug are used in the management of the hemophilia? Tranexamic acid, heparin, calcium gluconate or thrombin. So definitely tranexamic acid is one of the best choice for management of hemophilia. Tranexamic acid. Okay. 98A. 99. In Duell's method of serial extraction procedure, what is the second step? Okay, extracting a deciduous canine, extracting the first premolar, no, definitely no. Extracting the first deciduous molar or extracting both the deciduous canine and first deciduous molar. So extracting the first deciduous molar, okay, is the second step. You extract the first deciduous molar for the easy eruption of the premolar. Okay, so that is the second step in Duell's method. Now, 100, the last question. Torsiversion refers to change in axial inclination, change in position, impaction of the tooth, rotation around its axis. Torsiversion refers to rotation around its axis. There is one axis and rotation around it. Okay, that is called torsiversion. Okay, rotation around the axis, torsiversion. So with this, we come to the end of the model paper 8. Okay, so I look forward to post more and more model papers. It is very easy. If you revise the questions, you will be revising all the subjects together. So do check out the playlist in the YouTube channel. All the model papers are given. Solve all the model papers, repeatedly solve the questions. This will help you to remember the question and answers very clearly. Most of the times in Kerala PSC assistant dental surgeon, the questions are repeated, so make sure you repeatedly study the questions, and always try to solve the answers, because we have very less time and 100 questions. Okay, so how much fast you solve the questions, that will actually matter in the rank list. Okay, so always mark the correct answers by avoiding the odd ones out. Okay, clear? Thank you. If there is any doubt regarding any of the questions and explanations required, you can directly comment below the video so that I can give you the explanation. Okay, thank you.